Hi there, I'm Blake. I'm the CEO co-founder of CareSignal, excited to dive deeper in this 8-minute video into how CareSignal is using data to bring our social determinants of health programs specifically to more patients and to keep those patients engaged for a longer period of time. I'm going to recap what I covered in the 3-minute video, but I'm going to emphasize how we use what we call CareSignal AI, which is our predictive and preventative re-engagement program to help keep tabs on patients who need it most. So, again, CareSignal is able to keep tabs on patients and scale care management or social work capabilities to even more patients, especially those with both chronic conditions and subclinical challenges like social determinants of health, as well as everything in between: behavioral health, substance use, maternal health, and more. We do that using the common denominator technologies, text messages, phone calls. Specifically, we even have relationships with the big cell carriers, AT&T, Verizon, Sprint, T-Mobile, Virgin, so that we can make sure messages go through for free and come back at no cost to the patients and members using our technology. CareSignal takes the brunt of all of those costs. The reason that we describe our solution as Deviceless remote patient monitoring is really it kind of takes the best of both worlds, almost a Goldilocks, of expensive, non-scalable, but very clinically valuable device-based RPM and scalable, but not very clinically effective patient engagement. In the context of social determinants of health, and this is where I think the American Health Information Management Association's focus is really timely, you need to go beyond biometrics. You need to be looking at patient-reported outcomes and capturing data and metadata over the long term in order to enable the greatest ROI as well as clinical outcomes for that population. The flow here, as described in the shorter video, starts with an identified population. CareSignal receives a list. We do all of the outreach, enrollment, and activation for that patient population. And by using our automated text and phone-based messages, capturing relevant data around a variety of social determinants areas, CareSignal is able to identify which patients need a deeper dive from the clinical or subclinical care team. These could be social workers, care managers, medical assistants for the organizations that are responsible for their care. And we're doing this today. We're doing it for tens of thousands of patients every single day across a broad range of conditions, of which social determinants of health is one. And as I mentioned briefly, our real focus here is more than just an academic program that is evidence-based, even though we have 10 peer-reviewed publications and thousands of patients worth of IRB data showing that this program actually works. It's to really get the rubber to meet the road. And what that means is not only activating and engaging patients in the first place, but keeping those patients engaged in a clinically relevant way for the long term. So now let's really dive into, from a deeper perspective, how we apply big data and predictive models to deliver long-term engagement around all of our programs, including and especially social determinants of health for this patient population. So I've mentioned it's actually now over 20,000 years of patient data and metadata that CareSignal has accumulated. We've used that and the 83 features that are most actionable to train a series of predictive models. We have some regression models that enable us to keep tabs on patients for the first few weeks they're on the system, but then we move more into things like random survival forest and SVM in order to keep those predictions accurate for the longer term. These are actually the same types of models that your car insurance company uses to predict that you're going to churn, that you're going to hop to a new insurance provider, and to prevent that by offering discounts. Once we've made those predictions, though, we're able to prevent about half of patients from falling off in the first place, which is really cool. I'll describe that in more detail. But let me go one layer deeper on our approach. So instead of just using predictive models, we actually apply Shapley functions to figure out what attributes are going to be most powerful in driving a patient to stay engaged or drop off. And you see that here. So it starts with putting that shape together, going through, this is just a representative heat map of all of the different features that a given patient might have. And then at the end of the day, you see a principal component analysis showing what's going to cause that patient to stay engaged versus fall off. So even though from the product perspective, it seems like we're just asking questions, that product only works as long as a patient stays engaged and is answering those questions. That's where the data side really comes in and hits pretty hard. And most importantly, as all of you know, it has to work, and it does. So of that fraction of a population, the 1 or 200 patients that I think are going to drop off, or that my system, CareSignal AI, thinks are going to drop off this week, we're able to prevent more than half, about 57% of them, from falling off in the first place. And of those that we successfully preventatively re-engage, 2/3 will actually be engaged at a higher quality, meaning they're responding to more questions or responding more quickly than they were before that re-engagement. Non-trivially, it actually costs CareSignal half as much to preventatively re-engage a patient as it does to enroll a new patient from scratch. So the patient wins, better long-term engagement around SDOH. The partner, our customer, wins because their population stays engaged. And at the end of the day, we create more value for everybody involved, which increases our ROI and our appeal. All of that shakes out, again, I recapped this briefly in the 3-minute video, all of that shakes out to industry-leading long-term engagement. We're at 50% engagement for a year without any predictive re-engagement at all, and about a 57% increase with re-engagement, which is something I'm really proud of. So let me take the last couple minutes here to recap what we're doing with regard to social determinants of health and subclinical drivers of health outcomes, because that's complementary to our offering around chronic disease management. And at the end of the day, predictive re-engagement applies across the board. With SDOH, we have both an introductory screener approach as well as a series of check-in modules that allow CareSignal to capture actionable information over the long term. Those modules, almost a dozen total now, wind up capturing everything from transportation and food access to physical safety to pursuit of new education. And this is not only an evidence-based approach, but because it's longitudinal, CareSignal is able to enable our partners to reach out at the right moment for any given patient. Again, on the data side, we've shown substantial improvements in PHQ-9 and other metrics by focusing on that population at the right time. And by using check-ins, we're able to create a relationship. So CareSignal is always a warm line. Patients can always respond, connect, or make a phone call to the number that's been texting or generating phone calls to them. So the door is always open. And I know that's kind of adjacent to, not directly involved with the data side, but it's important from a product experience perspective as well. We try to go beyond technology as a partner, providing both patient or member focused services around engagement, re-engagement, as I've described. We do the same thing, though, because our partners care about data as well. So we take a really robust reporting approach every month, quarter, and year. And we do deep dives into everything from activation, engagement, retention, even showing how risk status is changing over the long term. And I'm really excited that people like it. It's something that patients and providers alike view as creating a whole lot of value. So with that, thank you again for your time and attention. I really appreciate it and look forward to providing any more detail we can about how CareSignal and CareSignal AI are leveraging data to deliver better outcomes, longer term engagement for populations with social determinants of health challenges. Thanks.